What are the symptoms coronavirus? Shortness of breath is not usually an early symptom of COVID-19, but it is the most serious. It can occur on its own, without a cough. If your chest becomes tight or you begin to feel as if you cannot breathe deeply enough to fill your lungs with air, that's a sign to act quickly, experts say. Fever is a key sign of COVID-19. Because some people can have a core body temperature lower or higher than the typical 37 degrees Celsius, experts say not to fixate on a number. Dry cough, coughing is another common symptom, but it's not just any cough. A dry cough that you feel deep in your chest. Chills and body aches, the beast comes out at night, said CNN anchor Chris Cuomo, referencing the chills, body aches and high fever that visited him on April 1st. Not everyone will have such a severe reaction, experts say. Some may have no chills or body aches at all. Others may experience milder flu-like chills, fatigue and achy joints and muscles, which can make it difficult to know if it's flu or coronavirus that's to blame. Sudden confusion. Speaking of worsening signs, the CDC says a sudden confusion or an inability to wake up and be alert may be a serious sign that emergency care may be needed. If you or a loved one has those symptoms, especially with other critical signs like bluish lips, trouble breathing or chest pain, then you should seek help immediately. Digestive issues. At first science didn't think diarrhea or other typical gastric issues that often come with the flu applied to the novel coronavirus, also known as SARS-CoV-2. As more research on survivors becomes available, that opinion has changed. Pink eye. Research from China, South Korea and other parts of the world indicate that about 1% to 3% of people with COVID-19 also had conjunctivitis, commonly known as pink eye. Loss of smell and taste. In mild to moderate cases of coronavirus, a loss of smell and taste is emerging as one of the most unusual early signs of COVID-19. Fatigueness. For some people, extreme fatigue can be an early sign of the novel coronavirus. The WHO report found nearly 40% of the nearly 6,000 people with laboratory-confirmed cases experienced fatigue. Headache, sore throat, congestion. The WHO report also found nearly 14% of the almost 6,000 cases of COVID-19 in China had symptoms of headache and sore throat, while almost 5% had nasal congestion. Older people and people with certain health conditions have a higher risk for severe complications if they contract the virus. These health conditions include lung conditions, such as COPD and asthma, certain heart conditions, immune system conditions, such as HIV, cancer that requires treatment, severe obesity and other health conditions, if not well controlled, such as diabetes, kidney disease, or liver disease. In most cases, it takes up to 14 days for symptoms to appear after a person has been infected with the coronavirus COVID-19. The period is also known as the incubation period. Although there is no vaccine available to prevent infection with the new coronavirus, you can take steps to reduce your risk of infection. WHO and CDC recommend following these precautions for avoiding COVID-19. Avoid large events and mass gatherings. Avoid close contact within about 6 feet or 2 meters with anyone who is sick or has symptoms. Keep distance between yourself and others if COVID-19 is spreading in your community, especially if you have a higher risk of serious illness. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Throw away the used tissue. Avoid touching your eyes, nose and mouth. Avoid sharing dishes, glasses, bedding and other household items if you're sick. Clean and disinfect high-touch surfaces daily. Stay home from work, school and public areas if you're sick, unless you're going to get medical care. Avoid taking public transportation if you're sick. You can greatly lower the risk that children pose of spreading or catching viruses by explaining to them how germs spread and the importance of good hand and face hygiene. Ensuring that they stick to the rules on social distancing, so no meeting up with friends however bored they are getting. Keeping household surfaces clean, especially kitchens, bathrooms, door handles and light switches. Using clean or disposable cloths to wipe surfaces so you don't transfer germs from one surface to another. Giving everyone their own towel and making sure they know not to share toothbrushes, etc. Keep your home dry and airy. Bugs thrive in musty environments. The proportion dying from the disease appears low, between 1% and 2%, but the figures are unreliable. What are the chances of dying? Thousands are being treated but may go on to die, so the death rate could be higher. But it may also be lower if lots of mild cases are unreported. A World Health Organization (WHO) examination of data from 56,000 patients suggests 6% become critically ill, with lung failure, septic shock, organ failure and risk of death. 14% develop severe symptoms, like difficulty breathing and shortness of breath. 80% develop mild symptoms, like fever and cough, and some may have pneumonia. Please subscribe our channel for more information.